Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine Chiropractor, and we are talking about bench press, shoulder injury, elbow injuries, and some of the treatment options you have, so stay tuned. Thanks for watching. I'm here with Coach John, and we're doing a whole bunch of series of videos on shoulder injury, elbow injury, and bench press. So what are some of the treatment options? Number one, I hope you don't injure yourself. How about that? Prevention. We just did a video on what to watch out for, so make sure you watch that. And so obviously your form is important. You can't sacrifice your form to up your reps or the weight. Keep that in mind. Be smart, right?
Yes, definitely.
But your options, honestly, don't do the cortisone shot as your first option or second option or third option for that matter. There are so many other options available if you're into injections. So first thing first, you really want to understand what the extent of your injury. Many of these injuries don't require surgery, they don't even require injections. But your options in general, in my practice, I assess the shoulder. I do a lot of active release technique and functional rehab. I adjust the neck. That's important because your neck and your shoulder joints are like this. That's buddies. So is your mid back and your clavicle or collarbone. But that's not always the case. That's not always an option for all shoulder injuries. I just assess them. If it's applicable, we do that. Cold laser comes in super handy if it's fresh. If it's not fresh, don't waste your time. So is ultrasound. If it's fresh injury, helpful. If not, don't waste your time. Muscle stim's helpful, but not really gonna help you that much. So it's one of those things that sure you can get it. DNS, dynamic neuromuscular stabilization, basically rehabbing it through developmental kinesiology, the patterns of movement that you went through as a baby to develop the strength in your pecs, upper trap, or neck muscles, and your scapular. Those are super important. Why? Because all of this stabilizes your body while you're working out this. And now let's talk about injections. Cortisone, I'm really not a big fan at all. So we have PRP, which is a great option. When I say we, not in this office, in general, we as human beings in this society, we have that option. They grab your own plasma, they run it through, or your blood, they run it through centrifuge, they take the plasma out, inject it right there, and it's your own body parts and body fluid into your own body. It's really, I have seen great results. You just need to make sure you go to the right guy or gal and rehab it properly. If you've injured it, rehabbing it properly doesn't mean lifting it, doesn't mean using bands and doing all that stuff, because really that just works on a specific muscle. You want to look at the whole picture, and the whole picture is not going to be coming through isolated exercises. It's holding poses, it's going through movements that involve the shoulder joint, working with the rest of you. Anyway, hope this helped. This video is a tiny bit longer than I wanted it, but I could not let you miss any options that you have. If you like what you saw, please subscribe to my YouTube channel. Make sure you ask me and Coach John your questions, and do know that you are the outcome of your own decisions. If you don't like what you see, change it. That's a good one.
Yeah.
Thanks for watching.